You spend roughly a third of your life doing it. Lying down, eyes closed, completely vulnerable, trusting that your body knows what it's doing. But here's the thing nobody tells you. The way you sleep, the exact position your body settles into every single night, could be quietly working against you. Not dramatically. Not all at once. But slowly, night after night, like a leak in a pipe you didn't know existed until the ceiling caved in. We spend billions on mattresses, pillows, sleep trackers, and supplements. But we almost never stop to think about the actual shape our bodies make while we're unconscious. And that shape, it matters more than you'd think. It affects your spine, your airway, your heart, your brain, your digestion, your nerves, and even your face. Yes, your face. So today, we're going to walk through the 10 most dangerous sleeping positions, not to terrify you, but to show you what's really happening underneath the surface while you dream. Some of these will surprise you. Some of them might describe exactly how you slept last night. And some of them might make you rethink everything you thought you knew about rest. Let's get into it. Number 10. Sleeping on your stomach, arms at your sides. Let's start with a position that looks completely innocent. You're flat on your stomach, face pressed into the pillow, arms relaxed along your sides, legs straight. Looks peaceful, right? Looks like someone completely knocked out. The problem is what's happening beneath the surface. When you lie face down with your arms at your sides, your entire body weight is pressing directly onto your chest and abdomen. That compression doesn't just feel uncomfortable. It actually restricts your diaphragm, the dome-shaped muscle just below your lungs that powers every single breath you take. When your diaphragm can't move freely, your breathing becomes shallow. You're not getting the deep, full breaths your body needs to properly oxygenate during sleep. Over hours, that shallow breathing adds up. But the spine is where this position really does its damage. Your lumbar region, the lower curve of your back, naturally arches inward. When you're flat on your stomach, that arch is forced to flatten and then reverse, creating a strain that runs the length of your vertebral column. Your spine is designed to maintain a specific alignment. Stomach sleeping destroys that alignment for 6 to 8 hours straight. By morning, you're waking up with lower back stiffness that you might blame on the mattress, on age, on anything except the exact position you were sleeping in. And the neck. Oh, the neck. You can't breathe face first into a pillow all night, so you rotate your head to one side. That means your cervical spine, those 7 delicate vertebrae holding up your skull, is twisted at an angle for hours. Repeatedly doing this leads to chronic neck pain, muscle tension headaches, and over time, can contribute to cervical misalignment that sends radiating pain down into your shoulders and arms. This position is especially risky for pregnant women, for people with lower back conditions, and for anyone already dealing with nerve compression. And yet, an estimated 16% of adults sleep this way every night, completely unaware of the slow structural damage compounding over years. Number 9. Stomach sleeping with one arm raised, the skydiver. Now let's take that stomach sleeping position and make it worse. Meet the skydiver. You're face down, but one arm, or sometimes both, is raised above your head at an angle. Like you're mid-free fall. It looks dramatic in photos. In practice, it's a nerve compression nightmare. When your arm extends above your head while you're lying face down, you're stretching the brachial plexus, the network of nerves that runs from your neck through your shoulder and all the way down your arm. These nerves control sensation and movement in your arm, hand, and fingers. Keeping them in a stretched, compressed position for hours puts you at real risk of what's commonly called a dead arm in the morning, that numb, tingling, pins and needle sensation that takes minutes to shake off. Most people laugh this off. It's just a dead arm. But repeated nerve compression isn't a joke. Over time, it can contribute to conditions like thoracic outlet syndrome, where the nerves and blood vessels between your collarbone and first rib get chronically compressed. This leads to persistent numbness, weakness in your hands, and in serious cases, can affect circulation enough to cause significant long-term damage. The raised arm also torques your shoulder joint. Your shoulder is the most mobile joint in your body, which means it's also the least stable. Putting it in an overhead position for hours under the full weight of an elevated limb creates stress on the rotator cuff, the group of muscles and tendons that hold your shoulder together. Rotator cuff injuries are notoriously slow to heal and brutally painful. And a surprising number of them have roots not in sports or heavy lifting, but in the way people sleep. Here's what makes this position insidious. It often feels comfortable in the moment. People drift into it naturally, especially if they run warm. The raised arm cools you down. Your body rewards it with drowsiness. But by morning, you've spent hours compressing structures your body really needed left alone. Number 8. Fetal position, extreme curl. Everyone knows the fetal position. Curled up on your side, knees drawn toward your chest, arms tucked in. It's comforting. It's instinctive. For most people, a moderate fetal position is actually fine. But the extreme version, where you're curled as tightly as possible, chin almost touching your knees, is a different story entirely. When your spine is in extreme flexion for prolonged periods, you're placing enormous stress on the intervertebral discs, the shock-absorbing cushions that sit between each vertebra. These discs are under significantly more pressure during forward flexion than in any other position. And if you maintain that extreme curl for 6 to 8 hours, you're essentially spending a third of your life compressing your spinal discs in a way they were not designed to sustain. For anyone with existing disc problems, herniated discs, bulging discs, degenerative disc disease, this position can actively make things worse. People wake up with radiating pain that shoots into their hips, buttocks, and down their legs, often misattributing it to sciatica rather than understanding it was their sleep position loading the disc against a nerve root all night. But the spine isn't the only victim. Extreme fetal position also compresses your chest cavity, restricting breathing in the same way stomach sleeping does, just in a different direction. Your diaphragm is being squeezed from both sides of the equation. And here's a detail most people never consider. The joints. Sleeping with your hips and knees sharply flexed, held in that position by muscle tension all night, can cause morning joint stiffness that is genuinely severe in people with arthritis or inflammatory joint conditions. You wake up and you can barely straighten your legs. Your joints have been static in a compressed position for hours, and they're not happy about it. The extreme fetal position also restricts circulation to the lower extremities. The tightly bent knees can compress blood vessels, leading to that familiar aching, heavy leg sensation in the morning. Your cardiovascular system worked harder than it needed to while you slept. Number 7. Sleeping on your back with your head elevated too high. Back sleeping is widely considered one of the better sleep positions. And for the most part, it is. But there's a version of it that quietly creates problems, and it comes down to the pillow. Or rather, too many pillows. A significant portion of people who sleep on their back stack 2, 3, even 4 pillows to prop their head and shoulders up. Maybe it helps them feel less congested. Maybe it feels cozier. Maybe it reduces reflux. But what's actually happening to their cervical spine is a slow-developing disaster. When your head is pushed too far forward and upward during sleep, your cervical spine, that natural inward curve of the neck, is being forced into prolonged flexion. Imagine holding your head in a forward nod position for 8 hours. The muscles at the back of your neck are constantly under tension. The discs between your cervical vertebrae are loaded unevenly. Over months and years, this can flatten the natural cervical lordosis, that inward curve that acts as a shock absorber for your skull. Loss of cervical lordosis is associated with chronic neck pain, tension headaches, increased risk of disc herniation, and even changes in how efficiently your nervous system communicates between your brain and your body. It's been increasingly flagged by chiropractors and physical therapists as a modern epidemic, fueled not just by phone use, but by poor sleep ergonomics. The elevated head position also affects your airway differently than you'd expect. At extreme angles, the chin tucks toward the chest even while lying down, partially kinking the airway. For people with any tendency towards sleep apnea or snoring, excessive head elevation can actually worsen those conditions rather than help them. The sweet spot, by the way, is one pillow that keeps your head in neutral alignment with your spine. That's it. Simple. But millions of people are silently damaging their necks one restless night at a time by stacking pillows like they're building a throne. Number 6. Side sleeping on your right side. Side sleeping is generally considered healthy. It keeps the airway open, it's great for pregnant women, it helps lymphatic drainage, and it reduces snoring. But not all side sleeping is created equal. The side you choose matters enormously, and sleeping specifically on your right side comes with a set of consequences that most people have never been told about. Your heart sits in the center left of your chest cavity. When you sleep on your right side, You're placing your heart in a slightly different mechanical position relative to your lungs and rib cage. Several studies have shown that right-side sleeping can increase the cardiac workload for people with existing heart conditions. It's not going to trigger a heart attack in a healthy person, but for anyone with heart failure, cardiomyopathy, or certain arrhythmias, consistently sleeping on the right side has been linked to worsening of symptoms and decreased cardiac efficiency over time. Then there's the digestive system. Your stomach and the lower esophageal sphincter, the valve that prevents stomach acid from creeping back up into your esophagus, are positioned on the left side of your body. When you sleep on your right side, gravity works against that valve. Stomach acid pools near the sphincter rather than away from it. The result is a significant increase in acid reflux and GERD symptoms during sleep. This isn't minor. Chronic nighttime acid reflux means your esophageal lining is being bathed in acid for hours while you sleep. Over time, this can cause esophagitis, Barrett's esophagus, and dramatically increases the risk of esophageal cancer. And it all starts with something as simple as which side of the bed you roll onto. The liver, your body's largest internal organ and primary detoxifier, also sits on the right side. Some researchers and functional medicine practitioners have raised concerns about the impact of consistently compressing the liver during sleep, though the evidence here is less definitive than it is for the cardiac and digestive effects. Right-side sleeping isn't dangerous for everyone. But for people with heart conditions, and especially for anyone who suffers from reflux, it is a meaningful, measurable risk hiding inside a seemingly ordinary habit. Number 5. Sleeping with your arm under your head. You've probably done this. You're lying on your side or even on your back, and you slide one arm under your pillow, under your head, as a kind of secondary cushion. It feels supported. It feels custom. Your body found its own ergonomic solution. Except it didn't. When your arm is pinned under the weight of your head for extended periods, you are directly compressing the radial nerve, a nerve that runs along the back of the upper arm and controls sensation and movement in your hand and wrist. This is the nerve responsible for the ability to extend your wrist and fingers. When it's compressed for too long, you get what's clinically known as Saturday night palsy or radial nerve palsy. Your wrist drops. You can't lift it. Your fingers are weak. The sensation of tingling and numbness can be alarming. In most cases, this resolves on its own once the compression is removed and circulation returns. But frequent, repeated compression of the radial nerve can lead to lasting nerve damage. We're talking about real neuropathy that requires medical treatment. Beyond the nerve, consider the shoulder joint and the rotator cuff tendons again. The weight of your entire head, which averages around 11 pounds, is pressing down on a shoulder joint that's not designed to function as a support structure while the arm is internally rotated beneath the torso. The tendons in that joint are being pinched between bones. Night after night, this is a setup for rotator cuff tendinopathy and impingement syndrome. And don't forget circulation. The brachial artery runs through that arm. Compress it sufficiently under your body weight and you're restricting blood flow to your entire forearm and hand. That morning dead arm feeling isn't just uncomfortable. It's your body telling you that the tissues in that limb weren't getting adequate oxygen and nutrients for hours. Number 4. Sleeping on your back with your legs elevated, but without proper support. Elevating your legs while sleeping sounds like medical advice. You've probably heard it for swelling, varicose veins, circulation issues. And in controlled, properly supported circumstances, it can indeed help. But the version that many people improvise, stacking pillows under their legs or sleeping with their feet propped at the end of the bed on an awkward surface, creates a biomechanical situation that can be genuinely harmful. The problem is angle and support. When your legs are elevated without proper lumbar support, the lower back loses its natural curve. Your lumbar spine is designed to maintain a slight inward arch even when you're lying down. When your legs are lifted, the pelvis tilts and that arch flattens or reverses, placing enormous stress on the lumbar discs and the muscles that run along either side of your spine. For someone already dealing with lower back pain, this position can feel deceptively good in the short term. The elevation takes pressure off certain nerve roots. But hours later, the flattened lumbar spine has been under sustained mechanical stress, and the morning consequence is often worse pain than when they started. There's also a vascular consideration. If the elevation angle is too steep, rather than improving circulation, it can actually create a pressure differential that causes blood to pool in an unintended way. The human circulatory system is designed to work in a horizontal position during sleep, with a gentle elevation of the head. Significantly raising the legs without the rest of the body reclined at a corresponding angle can put strain on the venous return system, particularly for people with compromised cardiac function. The DIY version of leg elevation, pillows stuffed under the knees and calves in a pile, also creates pressure points where the pillows dig into the soft tissue behind the knees, compressing the popliteal vessels and the nerves that run through that area. By morning, you've added knee pain to your list of complaints. If your doctor has recommended elevated sleep for a specific condition, that recommendation comes with specific angles, specific equipment, and proper support. The improvised version sitting in millions of bedrooms right now is a different thing entirely. Number 3. Sleeping in the semi-upright position, recliner or propped against a wall. We need to talk about the recliner. Millions of people sleep in recliners every night, either because of comfort, habit, snoring, back pain, or because they simply fell asleep watching television and never made it to bed. And on the surface, a recliner seems almost medically logical. You're not fully horizontal, which helps with reflux. Your legs are slightly elevated. Your head is supported. What could go wrong? Quite a bit, as it turns out. Sleeping in a semi-reclined position for a full night puts your hip flexors in a shortened, contracted position for hours at a time. The hip flexors, primarily the iliopsoas muscles, connect your lumbar spine to your femur. When they're held in a shortened position overnight, they adapt. They shorten. And shortened hip flexors are one of the leading contributors to chronic lower back pain, anterior pelvic tilt, and poor posture during waking hours. You sleep in the chair for the relief, and you wake up with back pain that follows you all day. The neck is another casualty. Recliners are designed for relaxation, not spinal alignment. The angle of the headrest, combined with the way the body naturally slides or slumps during sleep, often results in the head falling forward or to one side. Hours of cervical flexion under head weight causes the same cervical lordosis flattening we talked about earlier, but amplified by the instability of a position the recliner wasn't designed to maintain. Then there's the deep vein thrombosis risk, the DVT risk. Sitting for long periods, even in a recliner, without moving keeps the calf muscles inactive. The calf muscles act as a secondary pump for venous return, squeezing blood back up toward the heart as they contract during movement. When you're asleep in a chair and not moving for 6, 7, 8 hours, that pump is off. Blood pools in the deep veins of the calves. This dramatically increases the risk of clot formation. DVT itself is dangerous. But if a clot breaks loose and travels to the lungs, that's a pulmonary embolism. And pulmonary embolisms kill. This isn't theoretical. It's the same mechanism that makes long-haul flights dangerous. And plenty of people replicate those exact conditions every single night in their living room. Number 2. Sleeping on your stomach with your head sharply turned to one side. We already talked about stomach sleeping on its own. But this variation is different enough, and dangerous enough, to deserve its own entry. This is the stomach sleeping position where the head is not just slightly turned, but sharply and deeply rotated to one side, often with the face almost entirely facing the mattress and the chin almost touching the shoulder. The immediate structural problem is obvious. The cervical spine is in a position of maximum rotation combined with extension. You are holding your neck at its absolute mechanical extreme for hours while simultaneously loading it with the weight of your chest pressing down and your head unable to rebalance. The muscles, tendons, and facet joints of the cervical spine are under sustained, unrelenting strain. But the deeper danger is vascular. The vertebral arteries are two blood vessels that travel through small holes in the sides of your cervical vertebrae, running all the way up to supply blood to the brainstem and the back of the brain. When your neck is sharply rotated and extended, these arteries can be partially compressed or stretched. For the vast majority of people in normal waking movement, this is brief and inconsequential. But maintaining this position during sleep for hours creates a sustained reduction in blood flow to the posterior brain. For most people, most nights, nothing catastrophic happens. But there is a documented phenomenon called positional vertebrobasilar insufficiency, where the reduced blood flow through these arteries during sleep causes symptoms ranging from morning dizziness and visual disturbances to, in rare but real cases, vertebrobasilar stroke. This is not a common outcome, but it is a real one. And it is directly linked to sleep position. Younger people especially often dismiss neck pain as muscle strain. But if you regularly sleep with your head sharply rotated to one side and you're waking up with dizziness, visual issues, balance problems, or severe headaches, your sleep position deserves a serious conversation with a physician. Here it is. The number one most dangerous sleeping position isn't about spine mechanics or nerve compression or vascular strain. It's about breathing. Or more precisely, the stopping of it. Sleeping flat on your back is, under normal circumstances, considered one of the best positions for spinal health. It distributes your body weight evenly. It maintains the natural curves of the spine. It doesn't put your shoulder or hip joints under lateral pressure. For people without airway issues, it can be excellent. But for a staggering percentage of the population, sleeping on their back is actively, measurably dangerous. The mechanism is straightforward and brutal. When you lie on your back, gravity acts on the soft tissues of the throat, the tongue, the soft palate, the uvula, and the surrounding musculature. In people with obstructive sleep apnea, these tissues are already inclined to collapse inward during the muscle relaxation of sleep. Lying on the back makes this worse. Significantly worse. The airway narrows. It collapses. Breathing stops. Not for a second. For 10 seconds, 20 seconds, sometimes over a minute. And then the brain, detecting the catastrophic drop in oxygen saturation, fires a panic signal. The body lurches. The muscles of the throat contract. Breathing resumes. And the person either wakes slightly, or more often, never fully regains consciousness while this entire emergency plays out. This can happen 5 times an hour, 10 times, 50 times. In severe cases, hundreds of times in a single night. What does that do to the body? Everything. Every single organ and system in your body is being repeatedly deprived of oxygen and then flooded with stress hormones in a cycle that never lets your physiology fully rest. Your cardiovascular system, trying to compensate for hypoxia, runs in chronic overdrive. Untreated sleep apnea is directly linked to hypertension that doesn't respond to medication, because the medication isn't addressing the nightly cardiovascular assault. It's linked to an elevated risk of heart attack, atrial fibrillation, and stroke. People with untreated severe sleep apnea have a significantly higher all-cause mortality rate. And the brain. The brain suffers profoundly. Every episode of oxygen deprivation is a small stress event in cerebral tissue. Over years, untreated sleep apnea causes measurable reduction in gray matter volume in areas of the brain associated with memory, emotional regulation, and executive function. People with untreated sleep apnea show cognitive decline that mimics early dementia. And because the damage is gradual and the apnea episodes happen in unconsciousness, most people have no idea it's occurring. The position makes it worse. Studies consistently show that apnea episodes are more frequent, longer, and associated with greater oxygen desaturation when patients sleep on their back compared to sleeping on their side. In some patients, lateral sleep positioning alone is enough to reduce apnea severity dramatically. There is even a clinical designation for this. It's called positional obstructive sleep apnea, and it affects a huge proportion of people diagnosed with the condition. The terrifying part is the overlap between these two realities. Sleeping on your back is good for your spine. But for the estimated 1 billion people globally believed to have obstructive sleep apnea, many of them undiagnosed, sleeping on their back is slowly killing them. Not dramatically. Not tonight. But through an accumulating toll on the heart, the brain, and the metabolic systems that depend on oxygen-rich, uninterrupted sleep. The fix seems simple. Sleep on your side. But the body doesn't always cooperate. People roll onto their backs without knowing it. Pregnant women may not be able to maintain a side position. People with shoulder injuries find side sleeping agonizing. The answer, increasingly, is a combination of sleep positioning tools, a CPAP machine, or both. But step one, the hardest one, is knowing the problem exists. So we've walked through 10 positions. Some of them you recognized immediately. Some of them probably describe exactly how you were sleeping last night. And if you're feeling a little alarmed right now, that's not an accident. But it's not the goal either. The goal is awareness. Because the solution to almost every single position on this list is available, accessible, and often free. It's mostly a matter of knowing what to change. A pillow between the knees transforms side sleeping from a hip straining compromise into a genuinely restorative position. A cervical pillow at the right height can protect the neck from the compressive forces of back sleeping gone wrong. A rolled towel taped to the back, yes, it sounds absurd, is actually a clinically validated technique for training people with positional sleep apnea to stay off their backs. A wedge pillow used correctly can manage reflux and respiratory positions simultaneously. And for those whose sleep positions are symptoms of larger conditions, sleep apnea, chronic pain, cardiac issues, the positions we discussed are clues. They're your body trying to compensate for something. A signal worth investigating rather than sleeping through. Sleep is not passive. Your body is doing extraordinary, complex work every single night, repairing tissue, consolidating memory, clearing metabolic waste from the brain, regulating hormones, restoring cardiovascular tone. The position you choose, or unconsciously default to, either supports that work or quietly undermines it. You spend about a third of your entire life asleep. That's somewhere around 25 years if you make it to 75. 25 years in a position your body will either thank you for or pay the price of. So which of these positions hit home for you? Do you recognize yourself in one of them? Maybe two. Maybe you've been dealing with a mystery symptom, a chronic headache, a persistent shoulder ache, a stiffness that won't quit, and you're now looking at it from a completely different angle. Let me know in the comments. I genuinely want to hear your experience. And if this changed the way you think about something as seemingly simple as how you lie down at night, then share it with someone who needs to hear it. Because sometimes the smallest adjustments are the ones that change everything. We'll see you in the next one.